Welcome to Bariatric Business Accelerator. I'm your host, Carol Clark, and today we are talking about benchmark metrics that define high-performing bariatric programs, both surgical and medical. And so bariatric program growth is not necessarily tied anymore to marketing spend like it used to be back in the day. Today, the highest performing programs aren't the ones who advertise the most necessarily. They're the ones who remove friction, follow the new rules of search, and guide patients very effectively. So the new front door is access and responsiveness to you and your program and your practice. Patients now expect healthcare access to feel as responsive as every other service that they use in their lives. If they inquire and they don't hear back quickly, they tend to move on. They have lots of choices nowadays. Healthy programs should aim for a response within minutes, not days, and successful contact with a fairly high percentage of their inquiries. Simple scheduling with 24/7 access online, if that's possible, and programs that respond quickly capture patients when they're ready to act, which is very important. And conversion metrics really tell the story of program performance. So typical ranges tend to be about 50 to 70% from seminar to consult, and then it's usually a little bit higher, about 60 to 80% from consult to surgery, and overall about a 25 to 40% conversion from all of your leads that you get. Programs that are below 20% often have a lot of hidden barriers like delayed follow-up, insurance confusion, or just really unclear education and next steps. It's not necessarily a demand issue, it's more of a navigation issue for many programs. And speed and referrals do matter, timelines matter. The longer the process takes, the more patients will disengage. We all see this every single day. High-performing programs will typically schedule consults within 2 weeks. They'll be able to complete surgery within 4 to 6 months, which I know there can be variable factors in there with insurance requirements. They streamline insurance and the testing pathways for patients so that they can meet that guideline. The referral growth is another key signal of health. When primary care providers consistently refer, it reflects great communication, postoperative care. But digital trust signals a big influence or influences patients in a big way. They look at a lot of things. They look at online reviews, they look at physician visibility, they look at your educational content to make sure you're addressing their needs. They look at all your patients' stories, testimonials, and strong programs maintain high ratings. They generate consistent reviews and they provide transparent education throughout the whole process that builds trust and reduces that perceived risk that patients may have. The shift defining the next era is that program performance is really the new marketing. Programs that respond quickly, simplify access, educate clearly and early, and guide patients confidently will be at an advantage versus those that spend most of their time advertising. So if you want to strengthen your program, think about how fast are you responding? Where are patients dropping off? How easy is it for them to begin? Because growth doesn't necessarily come from more promotion, it comes from better performance. So these things are really important, especially now with the way people are searching in their whole methodology for seeking care. If you'd like some assistance or somebody just to have a fresh perspective looking at how you're doing things, feel free to reach out to me. You can get a lot of free resources at weightlosspracticebuilder.com. And my goal is just to help people be as successful as they can be. And I love the programs and the practices that I work with. I'm blessed to be able to work with a lot of really high quality programs and practices, and just helping them have operations work more smoothly and a little bit more seamlessly, and helping with those marketing things too. So if you have anything that you'd like to talk about, reach out to me. Like I say, you can schedule a introductory call through my website, weightlosspracticebuilder.com. And in the meantime, I hope you have a great day. Take care.